Afrisali Gambian Kola Sulo Soto. Nito ne dabe fule killing kamodu karandi coronavirus na tankatro. Aiduni ana yija muna ya mobe la sudan. Dorsa zilantamena coronavirus. Badulu Afrisal ngai jetu ngejay. Ibenu mana dron ka fanyi jali fune bakere otu makam. Fankandalu sidali ni ngolu burano.
Hello and welcome to this special program here on Kerr Fatou. As you know, every single day we come here with our show, Let's Talk COVID and the coronavirus. Mu nekk feebar boo xam ne jaaxal na Gambia yëpp jaaxal na àddina si waaye Gambia bokk ci réew yi nga xam ne ñu ngi sax si xeex bi pour make sure ne coronavirus bi ñu mun ko contain si suñu réew mi baɗigol ngal bisimillahi na Kerr Fatou programme ton kaminke luwolum jang ka fomi lesto covid covid la kuwo kaca covid keta coronavirus di keta sati mi alon ko fewo femmu duniya kono momo be duniya kono ay mol jahal banku bal min be ko America Angleterre Germany wolle fongo be struggle kan with this virus ko ntolla Gambia banku ndiw min be ko Gambia bari womatina do ko lal min yalon ko be jati kende ala karola ifanam be la kato be ke kanne kaje ko fewo fe mi yalon ko Gambianol sulata ala jaralo karola ise minno mi yalon ko resources la mi yalon ka be available liutol ifanansa woke ka Gambianol tankandi awala na bi I have the honor of having Dr. Abubakar Jagne. Dr. Jagne is the head of treatment at the Dr. Jagne is the head of treatment for the corona treatment centers across the country. He's the head of the treatment centers across the country. Dr. Jagne, welcome to this program.
Well, thank you. Thank you for having me here.
And also, I have with me Dr. Buba MANJANG. Buba is the head of quarantine centers. I know today we're going to have a lot of discussions because I know a lot of things have been centered around quarantines as well. Dr. Buba, welcome to this program.
Yes, thank you so much, Fatou, for having me.
Dr. Buba, la line of a break and malon for ila internet or lombang is a breaking a little. So if you can just check that just a little, and also tilt your camera a little up, Domande. Yeah. Okay.
Okay.
All right. Thank you very much, Dr. Jagne. Dr. Jagne, dama bugon tay xam nga yeen fi ngeen tollu when it comes to the treatment centers at quarantine centers. Tay for them si Gambia rek quarantine bi lañ la wax ak treatment bi. You guys are playing the most important role si xeex bi because ku feebar ku ñëw si dëkk bi yéena dee deal ak ñoom so it's important ñu waxtaan bi si suñ local language yi nga xam ne maire yee mag yi nga xam ne ñu ngi toog si kër yi ñu déggañu am na solo tey dama ko dee wax corona bi suñ biggest jàngoro si corona bi mooy ñàkk a góom bi gis nañ ne suñ ñu bari soo waxee ñu ne la feebari tubaab la feebari waa kombo la gis nañ ne loolu moo ñu gën a dimbale sax si liggéey bi because soo ko waxee xam nga nit ki su gëmul sax li nga xam ne moom la ñoo wax du mun a jëfandikoo li nga ko wax moo tax am na solo ñu wax si ñooñu directly waaye ma bëgg nga wax ñu rek yow as the head of treatment centers yëpp si réew mi jox ñu an assessment of tey fan lañ tollu si coronavirus as far as yéen seen liggéey nga concern Dr. Jagne.
So currently, I'm sure you know he gives figures.
Yeah.
They're quite jumpy. Where COVID is a disease. Febar la boo xam ne su commencé di sax pour nga am control over it becomes quite difficult. I'm sure some 3 months ago when I met with you at sanatorium, I don't like how far are we? I said to you there, how far we go depends on how much the public is ready to sacrifice to make sure we keep this disease at bay in terms of ñoo dugg ci dëkk bi and ñoo indi feebar bi ak suñu indi feebar bi tamit naka la nit ñi war a aaree seen boppa support the process of the government in trying to distance people away from the disease in terms of gatherings, in terms of physical and social distancing, in terms of hand washing, in terms of alerting people when people are sick, and distancing yourself from people who are sick, and then be able to support the process that are being taken to make sure that this disease is kept at bay. But this was 3 months ago, and I'm sure from 2 months ago to now, I think you will be able to witness that or time they were no more doing that. You remember Senegalese border was closed with Gambia, and at least we had so much control at some point. Knew them. The airport was closed at the time, but no sooner that people just decided just to ignore, even though with a state of emergency, you find out that people are still roaming around. In a state of emergency, go to the markets are full, nobody's putting a mask, even though they knew that these were the things that we need to do to make sure that we prevent ourselves. And they will come, so then bulen dugal lopitan ciobi commencé suñ ne ñoo lopitan nga laaj leen da nga tukki or da nga am ko nobody wants to tell the truth. Ñeneen ñi sax su lañ laajte ñu ne demuñ fenn fekk diggante bi Sénégal lañ jógee. Even their accent will tell you that they are not Gambians. So you find out that some Gambians will have to cooperate with them. ñoom ñoo leen a indi lopitan and suñ leen indee suñ leen laajte kii fu mu jógee, and then the truth is never said. Some people have gone to the point where you will operate land and they didn't know that until they come after the operation. You test them, they are positive. And I'm sure you've seen the number of doctors and nurses who've been infected based on the fact that people are not saying the truth. So on call like that, on 2 occasions, I have been deceived because I've asked patients questions. They took you on, and you come around, and until you insist, sometimes you come to find out that what they're saying is completely not true because the clinical picture. But then they've got in contact with it. So what I will start with and where I will end with is the public. People have to get ready. People have to get prepared. We don't have the resources, but the government is doing their best to make sure that whatever they have, we're able to gather. But I'll tell you that even if the whole of the Gambia's economy is to put together to fight COVID, we cannot sustain it. So the people have to be ready. Everybody has to be ready in wherever you find yourself. Are you at immigration? Are you at the port? Are you at the ferry? Are you in the market? Are you in your house? Are you a health worker? Whoever you are, wherever you find yourself, make sure you do what you're supposed to do to prevent the public.
Wow, loolu am na solo because comme ni nga ko waxee rek gis nañ léegi ne health workers yu bari ñu ngi am feebar bi te lii some of the things li nga séntu nii mooy war na nekk na si some of the causes lu tax ñu ngi am a lot of health workers ñu am feebar bi boo tukkee soo ñëwee obviously health worker dina la laaj sa history of travel, dina la laaj fan nga jógee woon. That will determine ndax yow da nga you are a potential nit koo xam ne war ngaa mun a am feebar bi. Waaye tey ñu ñëw tuuti rek si treatment centers yi. Bi ma waxee ak yow in 3 months ago ñu ngi tase woon sanatorium and yéen a ngi just launch for, I think that was the first, apart from the MRC, that was the first place bi ngeen xam ne yéen a ngi ko just ubbi. I think mu ngi am capacity of 10 rooms. Tey su ñoo wax 3 months after, what capacity are we looking at si treatment centers yi?
Okay, so the treatment center depends on depends on what we're talking about. Like sanatorium is for people who are critically ill.
Yeah.
So we have 34 bed capacity inside with 10 bed for ICU. Then we have another 10 bed for the rooms that you have been before. My rooms in Tase one the last time. Yeah. Those are single rooms meant for people who can be who are ambulant and probably are just not symptomatic and will be there for the period of time that they will be there for them to be seen and sent home. But now
Dr. Janyangi, sir.
Complicated than that now.
Mm-hmm.
Have more severely sick patients in there. Even on those 10 rooms that used to be people coming in and then they able to look after themselves now are being used by for people who are quite ill. So that's for sanatorium. We have a Demban clinic, which is has taken long to finish, probably because of some difficulties, bureaucracy and so on. But then we have a complete 16 or 14 room capacity there with oxygen line in there, which we think is ready to start using. I'm sure we had yesterday to start with in Demban, but because we still had the securities to take up their role as to where they're going to be seated, we didn't start. So I hope today, this event, will to put people in there. But then you have other centers that we're using as hotels, like all over the world, how people are doing it. They get hotels that you use to accommodate people who are asymptomatic or mildly symptomatic, and then get health workers there, and they are monitored there. So in case they run symptoms that are getting worse, then you can move them to sanatorium or Demban as it is. So that is how we are. You can imagine the numbers that you hear, and looking at the capacity, you can imagine how many hotels we will need. We've got like 6 or so hotels with some as capacity of 50 something, some up to 140, 150 rooms. So these are places where we're accommodating these people, and they're being kept there to be monitored. So in case they show signs and symptoms that are getting worse, or they have anything that's critical, they will pick them up from there and move them to a sanatorium where the facilities are available.
Thank you very much, Dr. Jain. Legi ma ñëw ci Buba comme nga fa ñaamin drong niko COVID-19 nga minje bankol be ka minke wolom ka ni mol dun tanam banko kan ke quarantine Gambia fanan keta bankol timin ka woke banko dol nak wol ka quarantine ke wali ajel ko maybe they cannot accommodate something like that. So bari nin nata itelebe mararing wo bundala quarantine area to lafta ya funye drong muna na situation oti right now at our quarantine facilities. How many people do we have under your care?
Yes, thank you very much, Fatou. Abarakabaki. I'm quarantine for the total of like they on quarantine. Staff from Modi quarantine fairly me along. At Mutantan low bundal COVID-19.
Yeah. Hold on, Buba. Dr. Jayange Dega Buba, the family line and bangi distor, right?
Yeah, it's shaking, yes.
It's shaking so bad. Dr. Buba, can you say something, Dr. Buba? Let me hear.
Okay, are you hearing me?
It's still doing that. It's still doing. Maybe you should use the headphone. It's still doing that. Maybe.
Is that okay?
Yes, that is good.
That is good, huh?
Yes, that's good.
Okay, perfect.
Go ahead. Go ahead.
So, me foka drong. It comes here in cabin. Quarantine fenet me alongo. Atemu nyung kurang COVID-19 kurang tangkan di rolem. Ya jere. Ha, nka mike drong walem komsa ning kurang be mola. O nsobita ko. Mo se kurang sotono le botanan tama jula. Wala ite mu moliti ini momi ya kurfanyo ya ta joka wala le nyo soto al sutia ta nyola. Kaje ndata je ko waya soto ite keke contact le ite tambala ite fana mu molti mi alonko e botanan dinkiral ton se sobiko ya kurang nyi soto. So nkete sabandi molle la minima soto folo. So on sabandi mola wala nke sabandi dinkiral kinde keda por korosi kaje ko fo ite keke bodi mi alonko sobita dinga fo bijela fo kurang ke sosol fo baso. So by quarantine that rada wala kan dimbal tangka suko na jama ki tangka suko taru ni mo bije bi alonko kurang petle ko na tabajla ite to ma bo fal ka ko ye kurang ni so e ko ta le da ta suko no dimbal ini dimbal ku fa ma ta joka ini hada ini la si jor sa ta jo joka no ke so ni kadiyo dibala ani wo sinyon bari akare mabbe fantana so bay la kuro ni sida janjang nda damu tanona abe janjang na bobe si sa soto sako ni kuro aka kebal fa nyabe asiata so bay la na mamawoli binki woli fa bawla de bi be suwol kono min ya loko ibalo la kura sojaro ibala sojaro min ka kuran keso kele amam bam bak ibayila wol jabal do fa so pour que o tankandi wala tinna nyin quarantine man sakunda quarantine jata kenda bunda anin double cho ya jeko quarantine mu fennete mi ya lonko din kirase jini abin ma kele plano fantoti bar din kirare mi se soto dame ni mol nata se sabate dije fo jandi kuronyin aka wajabi hanama du jato ko jami fo jandi go wuto be sia adini covid-19 go wuto ni narate go wuto tani nadati so wuto tani da do to ko se sabate di nga sample tebu nga sample te ya jide na nga jide fo ko ke so be la faketa a quarantine ta nata wala ni mute mari fo de mi do quarantine ba ko katu kebe ba ko le yela dibba ma be bari alo jamata faham la isalo harba do rasulo ete ka jebbu tabata ndati bal bijara nam so bijara de tela interest minti wala nga fota wala ibi ka lon ko ni mu fennati pour ete be interest minna pour yeje yalo e kanun tel lawol so pour ngare ete kala mode bibbe sonna pour ko hol bantora so nyimbu ma so kunda be ete ba ko e kanne jata kenda bunda be ba ko e kanne ka je ko wo moli la o kanin tele kane bantora quarantine tata wala
quarantine tata wala
totalo bi aloko ucho mi ngamuta sainte mi alonko be sabateri in fact me muta wala mol mi alonko nye sabateri din kirakili wala quarantine late atatal fo mo keme saba tan saba nin kononto wala bije sainte yajele so wol fanam betarre korosi kanne fo jannim be bulala ni negative ta ni result so nga korosi ko nata je ko ete may kuran keso so ke wala se so abona
so akamta ko woto sa akamta ko momo dunta Gambia banko kan luwalom ko inyanta tala true quarantine lale pour kaje ko kuran keso ni ikana janjande wolon luwa ni tembe nyin tembo men
wala luwa timbe yimbe tembo feta quarantine folo nge korosi ngajo te ibalo sere ata ni kuran keso alhamdi tata so ko ite ke mo timbi alonko ise kara janjandi jama ko wala sa dila di mbala be jikila ko ni tate senaro bi tasu so ko be akelante membe covid-19 na fanala so mbo korosiro la bari luwali fanan quarantine yalo folo betil tande nani ngole di bari nata luwali yalo e ka du ko no nyamen kul ka faji fali nyamen anaka wajabi nyamen ntolu fanan kan na firol bundal fali wala nyama kaje ko ning ko nyin nata nyamen nay krimbasi wo nyama isaje insa control no so nga falindiro dan tankele anyaton sina o fali
ngaminje banku dol kan wolon ko ni mol kananan e ka test leke ni la test kananan ni la negative test results nata they don't have to go to quarantine because ni ajube banku jamal ko leke bi mbetembo minto pour fanan nyinkelo atekeno la ni la kudo beta ya dundi quarantine kono because kamo keme saba koran kamo keme lulu sindi dula kilim fo tilitan ni lulu anu momo nata banko ka yesindi fotilita ni lulu mansa kunda ka kodi jamale depends wokan muna tinna amanke kuti mi alon ko atol la do ku bunda ya je ko tonya mol min ka tamanan sako mol min ka bonan tubabu du ye opportunity soto la ka teske ke la certificate ol nati ni mi negative test results soto so wol admit no banko kan within 72 hours isaje ko ni dunta banko kan they don't have to go through quarantine nyanta ko do min spend la wokono so wo dundi local transmission wokono wo banke fenti mi alon ko alba wojube kam pour ko implement banko ka because no wonte tonya mbe ko do min dun kan quarantine bi asiata ba
okay fatwa ba ke wala fanna tin kana min foe falindrol min dole keteng way fannal min ma follow wala ite tamala ite min pareta wuli kanela dimbal jibe walle sola ko soto ibe tamasilo kan be min fola wali walam jandi bina na sarta kutole mi itandi quarantine na fannala wala ite janta kala multi tastero ki o tastero janta kala within 72 hours montro wucho taw woro wala nim fula ajanta wucho sila wobatara wala tinna a valid an tolbe wala cross la kaje ko itala test be valid linne abe betari ne abe senari ne ansai so nini do nata ite be kala molti mi ya lonko mbe bulala le yeta suwo ko ita da masakunda paranta do ni tole ite be ta suwo ko no ba na police ro be tare ka hadore fakita ne nani kaje ko ite ma ke molti mi ya lonko kura keso nyina mandara goli ye fintindi ete molti mi alo hansai ibala jatu be sahani ne kono but ni kita molti mi alo ko ani test results nara ngebule tata suwo kono bar na konsilo mucho kono nata jina condition of falenta mimbo ko kura keso na mandara go yo le fintindi ebe kala molti mi alo ko be sula kay samba ke taste okay womu fatna kilindi fanna fulanja wole bindi ya lonko ebe tamasilo kan inata nyimban kunka ayatare man tastero ke man kai to yitan din tolla kaje ko to le tastero kele kaje ko nyukura keso ya taste kele negative tale woto wolmum molte mi ya lonko be sambala na quarantine tulato bari tastero be kele la be sampulo talete mari baloto den ya taste na negative ta ebe sela suwo kono ite tande nar kala jede mbe sularin kaje fa negative tala fa positive tala wala mbe sularin kaje ko foete kuran keso nyi ya soto le bang fo ma soto ni ma soto nin tastero ay tandi ko ete ma kuran keso nyi soto ete ka ses ba fale ses woko ha ibe sela suwoko no bar mbe tarre monito kankela kol kisis kaji ka koros yaje nyille fannal tinga mini landi kwaranta man ko sai binale ni na ta yafen bari ite la o tastero jing yemin ke fawle ba jola de e fawle be la tastero jola andu i fawle be la quarantine jola wo wucho kono bawo ete kata molti mi alon ko e man tastero ke janni be bolela tama jola e man kayti tan din tolla min bayi tan la ko ete e fantastele e negative tale wote te be kala molti min be sambala quarantine jola andu i fawle be responsible le la quarantine jola andum e fawle be tastero min be kele kunde fawle bo fanan jola ete fanan be lola ko e fawle bo jola ko ma sekunda sila ka to sila ko le ngi falin pour mo be sa kala buta na be ya faham
wokuma yata bake pour bari ngol yalla lolu amna solo amba fala surwa kan la comme mol min ya lonko I lafta anybody who's planning to travel into the Gambia as we speak now you at least you should have a test certificate, a negative certificate in coming into the country. But in case you have not tested, once you get here, you will be tested at your own cost. If you need to go on quarantine, you are going to pay for your quarantine yourself. I think do Dr. Bubay will for Kodi.
Exactly.
So I
what
think
a new protocol
because including myself, njama ba complainta wala ko andu ngaji ko waya tinale ko local transfers toldol filter ko maybe you guys are lacking in that area. Dr. Jane bugana nyo fofu nono. When it comes to the treatment centers ninyange halat naka nyinga xamne ñu ci treatment center bi because ñun ñëpp xam nañ ne corona bi moom amagut faj amagut vaccine xam naa ne basic treatment ngeen leen dee jox waaye gis nañ ay nit génn si di wax ne paracétamol sax ñoom buñ ko soxlee si treatment center amuñ ko seen mbokk yi lañ dee waxal ñoom pour ñu indil leen am na ñu alej ne sax seen nit ñi dañ dee dugg si treatment center yi ñu ñëw toog waxtaan ak ñoom di leen indi lekka people man nag wax naa ne when it comes to lu mel ni lekka ak yooyu man duma ko dee address because ni nga dëkkee sa kër mun loo dëkkee noonu si treatment center yii nii because definitely du benn su ma dëkkee suma kër di toogal suma supa kanja yu neex expectu ma ne su ma demee si treatment center bi lu ma bëgg a ñooñu lañ maa toogal waaye nag bu patients yi doore di complain about the basic necessities lu mel ni paracetamol lu mel ni even xëj na jël seen temperature wara sax ñu ngi wax ne ñu ngi am bagage outside because barki dee ma wax naa ak coordinator general mu ne treatment centers yi dara warut a génn outside pour dugga si biir fekk victime patients yi foofu loolu docteur Diagne boo ko déggee yow ngay head of treatment center nit ñi di joxe façon assessment bii ne lii mee xew si suñ treatment center yi looy tontu ci loolu.
Okay, Fatou, that's a very important point. And I know that Gambian la filadika
Yeah.
Strangely enough, Gambians, we always hang on the wrong side of stories. Gambia is the only country boo xam ne da ngaa ñëw lopitaan nga jógee gis ñu gis la pare nga foog ne because gis nañ la docteur gis na la joxul la garab yaa dem jënd sa garab kon defaruñ la dara. I'm sure ne yow aman xam nañ ne could them to see a doctor in other parts of the world, even just for a doctor to see for free, that's a lot of gifts that you've gotten from the hospital. But Gambia is because we are not aware enough, and secondly because we're used to this free, and so we don't value even what we have. Most of the people who are here, I don't want to encourage you to somebody's into the quarantine, but I'll tell you that what we have in Gambia for people, nobody have it anywhere in the world. The treatment center, the feeding from the treatment center, it comes from the hotel, Atlantic Hotel, that we've been accommodated in. All the food, three meals a day, come from Atlantic Hotel. What the staff and doctors are being fed, the same food, so you think the food is and your family want to bring you food, well, let's tell them that they will bring disposable bowls, food in disposable bowls, and then the food won't come out again because in the they give you three meals a day, and they give them 3 drinks a day. That I'm aware, and I know that there is a constant supply of that in all the treatment centers. The sanatorium is from Atlantic Hotel, from the hotel that are accommodated. They supply with the food that and the drink and the water that they need to drink. To come to the FAGNE paracetamol, they ask for amunco, or you're talking about close to 90-something people in one treatment center. In some centers, 50-something people, depends on the situation that is there. You have nurses there, you have doctors that are there, and you ask that they're looking around with you. I think the government is supplying, even in the hospitals, paracetamol, whatever they need to give them. But I'm not sure that there's any hospital in this country because the numbers are a lot. The need can come at the wrong time. Or even digi paycheck, and then your loss of luck at that time. And if you think it's easier for you, like some family general, we don't have a problem with that. And I think that the government should even go further to make sure that even just as we are saying for quarantine, for treatment, should have a contribution to this, because government cannot do this in anywhere. There's nowhere in the world where you go to hospital and you expect that low. I mean, we buy Sarlacc for kids there. We buy tampons for women. We buy clothes, even here. At the treatment center, they just came from quarantine. So they know them gender I malan I mbuba lenkojo. Sajada, you've been to that room in the treatment center. Yeah. You've seen that the place, everything is there in terms of what you need. And you'd be surprised that some people even gathered some of those things and took them home. And we have to replace them. Yes, you'd be surprised. Yes, and even some of the food that we give them, that we use to communicate with them, some people have gathered them and taken them home. So it's a strange community we are in. People, they look at the things and they say yourself or you come back to listen to what they say after they left the place. You're surprised. Could this be true yourself? But I'm telling you that the treatment center it used to be even better before, because then we used to have people who are very stable, they're fine. But now, as you can see, the people who are there are quite ill. I'm sure the demand is higher now. But when things were even better, we used to have a lot of people, they asked that sometimes, at least on 3 or 4 occasions, I'm sure I went to Fast Alice to buy chicken for some people who said they don't want to eat canned beef, or somebody say buguma leka diw and buguma leka li. So I know food part is quite difficult, especially somebody who is sick.
Yeah.
And some of them, they don't have appetite for the food. We have to find a way to give them some other alternatives. I've been to the hotel to talk to them about giving versions of food that are more Gambian, because hotels are always cooking this continental dishes. So we have to ask them to change their meals to more local food. But I will tell you that the food that they're eating in Atlantic Hotel is what is being supplied to all the patients in sanatorium, and the food that's given to people in all the other hotels have been served in the hotel themselves. So nobody brings food from hospital or any other institution to bring to them. They are fed as if they're tourists in the hotel. That's the food they've been eating. So if you have time, maybe you should go and see at one time, so that you're able to see the food that they've been given, at least so that you will convince yourself as media persons. Sometimes that will help the public to know. But I'm just surprised at Gambians, the fact that people don't come out to say that not only the truth, but to say the reality that exists. I practice outside the country, and I know that if this was somewhere else, I'm not sure food would be the priority right now, because of the amount of effort and contribution that people are doing to make sure that people are kept alive, and the number of times that efforts and sacrifice that the government is doing to be able to maintain these places. I think is a lot for people to say thank you to both the staff and the government that is giving the food to them.
Yeah, and I do understand the challenge right now, because we have so many people in the treatment centers. Like I said, the system is getting overwhelmed, and even some of us who travel across the world, and you get treatment in any major hospital, most of the time you buy your own medication. But I think the reason why people are also concerned about patients suñ amutee garab mooy, since they are in treatment, te li corona mu nekk feebar boo xam ne soo gisee ngeen la quarantine mooy bugg leen ñu in contact with anybody because of feebar bi ni mel. So su dee nit mu ngi treatment center, mu soxla paracetamol wara mu soxla cough medicine, and munul koo am, mu war a yónnee ci biti, would that not defeat the purpose of even quarantining them?
Okay, see, I don't think it does completely anyway. Although I have these things, I only hear about it on media, or somebody tells me on a phone call. But I know that all the people who are under treatment, if they need something, even if they're going to be able to buy for them from outside, from family, the family will bring it and give to the healthcare nurses, healthcare staff. It'll be a prescription that will be given to them and told what they're supposed to buy and bring and give to the healthcare staff. There's no way somebody from outside can go into the treatment center to offer even food to the patients there. So you bring your food, or you bring whatever you need to bring. Sometimes some things that you need, your personal needs, you can bring them, but you bring it to the security at the gate. The security will pick it up, and then they'll decide whose is it for, and then they'll deliver it to the person that needs it. So paracetamol may look big.
Yes. But I know psychologically, Dr. Jan, come nit kuy faju, I know I'm not a doctor, but dégg naa leen si seen wax yéen seen boppa, psychologically nit stress daf dey contribute si feebar torop. Bu nit nekkee loolu moo tax bu nit nekkee si nit feebaree, dañ ko defal everything possible pour mu comfortable ndax mu mun a naka lañ ko dee, mu mun a respond to treatment properly. Xel bi dal waaw. Léegi nag bu dee nit ñi ñu ngi si treatment bi, ñu ngi stress, mënuñoo li foog nga ne dina yomb pour ñu mun a respond to treatment. Ba pare tam yaakaaruloo ne toog isolation bi tam mun na bokka ci lu tax patients yi ñuy mun a react this way to some of these things yoo xam ne mu ngi génn si treatment centers yi.
It's possible. I mean, it's one of the things that it's not only pour confine qui place. It's one difficult psychological issue that people have to deal with. Often you'll notice that anytime you ask a human being to stay in one place, very soon that their reaction will be different. very soon their receptiveness becomes difficult. Unfortunately, unfortunately, these are people who don't have symptoms. Some of them, they don't have any complaint. They're just there because we want to be sure that they don't spread it to their family members. And we don't want them to, if they have to develop symptoms during that period, we want to act quickly so that it won't be that they are already at home and they're calling you that they cannot breathe, or they cannot even call you that they cannot breathe. And then you will know only for you to find out they're dead, or you find out that the condition has gotten worse before you can act, then it's too late. So those are the reasons why. And I think that people are now getting to understand. Before it used to be, okay, we used to be following people to be brought to the treatment center, but now people are calling to say that, come and pick me up, I'm at so-and-so place, I have symptoms and I want you to take me from here. So that is, the die is now changing. The numbers are getting bigger and more people are now responding. I'm sure that 90% of the patients who come now to treatment center are coming there because they know that that is a solution to their problem.
Mm-hmm. So wow, that's important. Dinañ ñëw si kanam tuuti si patients yi nga xam ne ñu ngi xaw a feebar bu baax, what is available to them, because the reports yu génn si tam gis nañ some of us am nañ family members yoo xam ne ñu ngi si soxla lu mel ni oxygène ak yu noonu, waaye dinañ ñëw si loolu. Waaye wax nga fi lu am solo, dinaa dem si docteur Buba. Docteur Jagne fem foja mi alon ka kumayata bake wolom kunung ni ntolle kata mol ni ke nati quarantine, ntolle kata ka mol contract trace, bari bi mol le fongo kananang new weekend o min tambita. I have said it to Dr. Modunjai, I have said it to Dr. Bite, I've said it to the minister. 1025 was not working. Mo buka also to know. Wo mu kulati mi alon ko technical problem lo bari ko a fix tale sign. Bari ngamin je fana wolom ni mol ye call ke ko isasata. Why are we not able to pick them? It takes sometimes up to 2 days, up to sometimes some people who are even tested and they tested positive. It took so many hours before we are able to pick them. For wobuka sasa janjanima bayra to leko ni sasa be momina rek anyanta isolate la sila ni moyal kumanda ko sasa ni waratul fongo mola test kiya ka positive tal munatina akalta that long la to pick these people. Dr. Buba.
Okay, abaraka bage yini karo jija so yalla dum ko fon be nyane wala bring kuro jinna ko masima China control measure be in on place. We have all the points of entries na staff would be there remember do na ye screen ye to pro you know medium kamole kaje ko haklo Kendala fanal nga before put fantanka ngi courant la na fa molé do di ata dol bata okay jambe alo dol sonda ko ni courant sonda le dol balanta dum dol bije wol kam molle hakilo jaxas drong wol bo hakil jaxas lal so we ko le ko sambana do ko ba halo we atana nimmi ya lonko ite keta moy timbi ya lonko e courant yu sin soto nkatale ila contacts wala ite ne min be nyoka ite min darota joka garange sika joni nge samba yajele yete ye quarantine ye cross prakana janja
wato la ko ke bari sayal bu ko ke
minaka so biribo ko no yalo silante say ko be jame nin kurona ta adana ta janja
ha
ya fam positive folsiata adi tulali ido mo jamal basu tula sen sol soto jana no so bayla ko nin ko tata fa a lafta siala e baye la ko ifanan kela strategy li falin mam fo en fam so ikela strategy fali kaje ko so accommodate no okay so kono e baye la mi yalo ko follow rota la joni tenga esika sila al siatale al bulidale for la transportation no in terms of roaming and capital marida na human resource and everything na mini plan na so staff and everything they put in place like so by la ding fancy fa ka be ya ko kuraw ji wala bitale ning yek ale call ke 1025 will ka forward le to picking team because the team letter ndema ko warata de bar rapid response begin o fana dole marata wola ya jele mim marata la dia di wola wolle kata kai sikana especially min yalo ko kuran keso so so ba ila wolle be kala bolti bini alon ko bina ni sikal e ke sikal amanga ko be ke sikal bar molle siat so ba ila te be tarawe dia indo samba jani bidete be complain bari kanale sikaye samba so lafta molle jele faham amanga ko nyina tela walle tu jele o so e kata din kirabinto e ka make sure le jani commandi ka je ko treatment center okay jani bul prepare aya parendi ka je ko ite bina ni data do ke dundi buminto bina jelto yajene no kaje ko mi follow commandiro ke lisole biji so ba la sikar lañi ibinale ke almar sika kal samba manke ko tujele wala be fenkelal wala an ka bori nyina yalo say ka nyine fo so kana tambinyina alinga duwa kana tambinyina wala nda balannal be nenela cause man jutila de ka fo mini ka balanko kura man soto num ane mini ka leptar ko dokulale kajafi ade mini kaje ko ka sambani sila dol fannal la bole asamba sila jamal bare ba fra bole ko alinga wol be landi nimmal landi ade fole bantura because pour ni na waja bida bele coffee la bele ko na ni mo ba fre man na sike tege ni man na mo le mu me ko mi ya lo ko na ni jan fele ya mi jam ke ga adu don be response adu na front line na so le to mi ya ko le ko ni sawali ni wonde ara wol folo ko so to bebe to folo jara ka fekka jara ah ni wol be ku danda wol bebe tare joma be sala afa
ha wo ko yala wala
kana yala wote sudla manna tunga futadat level nga sa bulo ledi woto sai mbe mol dane kan mbe kafu nyoma ngani courant kere ngaje ko this is one Gambia no nga frofeng momo ye mira ku so to holandi folo mbe kafu nyoma ngani courant ta nga kele ntole ya marol min di fantan kandora fannala mobe wota nga noma nyoma ko le ba ele dimba sitanke te fon sitanka so abe lari wala jama so mini yalon ko ila jini karo mini yalon ko kataraje ka me pour jandi be sikala wo mum pol di o yajele ko kuraw ni mini yasoto ade mini bum konta ko wala siata so ba ila foye kilin sika hay siata le son senyi maki wala bari ba tralale ka improvement sabara wo fannala
so munatina albuka mo jama tano doctor because tonya ambe tembo la bibi drong na colleague do ngaja life ke nte personally I ngomol soto mini alon ko ngeje they had difficulties and they were having breathing issues, they were having issues of getting 1025 nga kumandiro ke even with the connection on nga Minnesota in the system, we were not able to get them picked up on a time at a good timing. So muna tina wobuka keno 4 katunga jele ambulance tan nata nyi wato kono e alsula ta fewol min bela jama ba natale muna tinna albuka mol pick no on time munen problem oti capacity lombang anim fo alsula ta jorango dolela because tonya ngalon ne ko COVID-19 manke man sakunda da mala keloti, and I keep saying this, the private sector individuals ngaje lopta stadium moto albert tent fix kanje ngani nankaroke ikonyeko is a private individual who's trying to help, and this is what we're encouraging puru private individuals who lenai mansakunda da mate nola bari muna mato la problem oti fal buka molpi because doctor this is very important. Ni moe symptoms soto wara mo test positive ali afulala so kono 2 hours wo 2 hours o wobe mo jele infect nola wo kono wo ku mayatal and no fal bo molbe trace nola le bang
okay yalo ni na structure form be nyame when we have contact tracing team bigele biji quarantine team do quarantine ke sabana tole ya fa be bari be la ko be nyoko bari ga kukili loje kaje ko ite yanta yala be mo sike ka sabana ni moli siata fo da fata be kala nyaati foye expand foye dal yele ni wo dila yero be keri so ba yela ko fanyi do ala batro se mendi ko di bar wo make mon ngani yodi pour o maria e tarawo dinkirajin bar wo mol bali fanan na contact tracing anina rapid response ye tarawo mol kan be monitor wo bali fanan kana laboratory mol e kata futela le ni man nano anding atara jani wol be dinkirali yele kam pour kanyi mol sikate sambananji wo wucho kono katra lab mol tatete mari kela dinkirato yela samplota ndikatu je e kate normally yela samplota pour la status lo dol kan negative le dole positive you understand mini positive ta itela obaso wucho kono okatra dinkrani keno sotota isaje Mustafa na la timo ena yal sika yal samba so ko nyimbe lari wala nyama ay be batro kala to jaabe mendina bari nyanta tara dinkrami fanam to fo fana ye ay topoto ay betea ino katum kuro nyi siata wala ne ko pandemic atem fenati minna ay ko moma nyi coronavirus yalo dunia pe ko hada America be mo America ya ay ko la ko di
hade
julal be Angleterre France julal ni ba ko semma bal bar hado ay jakal ne bo ma nyinta yafuko ni kura sifa ito yafo yela struggle be briga kama bari ninga jopa nata na preparedness plan ke adu wala be tabaka wala ni response so bari lafta wala be faham fara wala kuro ni nim mol siata so fo ni dole ba ndike atara julal le bar ko ka mol ngani yori bari atara bije tuje bari kade no malera saplota yallo ila status be nyamen no ise topoto so amaga ko ka tuje o nyamani mol ka tare kanne na jaral lal ka tare normale na lab mol ka tare normale na contact tracing wolbe ajibe la jumale expose ta jumale ma expose bari bi ka tuje fay kane kamale yesamba nindin kirani feketa so wo wucho fa bi kamme fa amunta harama di wala hatajo kama anala koronto kama isa fo tebi ka kabri wadi me mandan kama andi like bari kanale yela samplote ye topoto ye fek so wolbe bi jele ma foko mola alla bat role bi kamme o so bar do ko di ba kono fo improvement so nka ko ibe complain so la jame ka improve wala kono nyam so ngela complain ol tale bari nga understand so bo kono imagine na quarantine protocol na falin dol soto je fenten courant ni siata jama kono nyame faranga na fero dol falin ko di so nyindo fanam go le nyama ila batrol ni poli wol bebe sol flale because fero de landri ne ka je ko do je be tetto dara ko private institution on mbe mi private institution ni ora organization international organization ade masa kunda fa ma ka je ko di private wole ma ko roke masa kunda fa ma ka je ko ni dol ka sia ja men di kale yele ka je ko be sabat la dane ka to so amato ko e blola na blola nyo ka de matra fenna je tu je wajama ba fero kana la ka jame because surani kama de bijane faraka fan sabole nyama ka je ka di akudi so haklo be nyo kan mente no la je ni mu kelo de ni ma ko kuri biya loko ka fo kelo le mbele be dala sit la ka kelendi wala tinda mbe min topoto ka wala community ti wala nyanta lalan tol kam nga nyo ma koy because ni be mom ma koy ka e kay prier fantanka abalanta yala ko yala ba ni kay purite e fantanka asonta fa ke ma koy o kola namo teno a control ka dial atopoto ka dial bari be ko e fam ma koy be barandi be bol fula nte kila nte manta baso dunda nte tita jana nte kala teg atla wo man toro yinna data etele nakete ke ye kura osodo ibe totola ni jobe ko laari bulu jubal be batara jubal folo be tarra batara abete binka woto puru ke tanka wo batajina ke la dimbal ka ko robin alinga ni muda no feba woto de na muda no fe na don tempu fo se boy ni ko kayra ko ala ko fa ma ko be no ma ko do na ru ne daniel be ko lidati sai na kele ko modo le fa ke fa di ko ne ke fa sama na ko so ga je ko muda fa buro do wala kan sai ya je il faut que fa sama isa je ko je na dal de ma de ko ma fa understand do lafta paranda wala ka rezon tem na dikrata fekita le lafta na dol kala fi fana ibe kala fa bol yalon ko ibe quarantine yalo ol bu stigma wolle so it can be understand kol kono nka katale ne kacha ye ben nga ben julato ngi sika e sabana wala ngi dare ki fon ye fan drive yena ye futa ye dum quarantine pour mo kana kalbuta ko bije ye tarje fo la tesol beke ngi bula ye sey yaajele wol bebe kerin bari nga min suute say wala gambanol ba faham kanne ko jata kende amola ren WHO la guidelines e be bulaka normal wo tama senyi tama serni ma balem lafta gambanol be alinga o kedron tubando be ajala ala sinam kisa nyin kono saja nye tabi mo be fansoto alka frio min fo mo be se free mo sita la business ola mo sita la tamo la plato mosala kolke mota fole na quarantine mantra keru num ñu courant la tin na ngake man na pour ka bo batandi quarantine pour kete fon ete tamala ite momi mbotana suwo kono because yimbo nyo asotole nkete le makoy amanna pour ke batandi amanna pour ke ete sapati di blackling amanna pour ke la business so tiga natale pour ke ete makoy pour la business so sidin soma e jata ke dan sake ira di bari ise fi ya ko bebe jata ke dan ni mo te manna mo la fa
abarka bake docteur docteur Diagne bëgg naa ñu wax si loolu tuuti because luñ gis mooy docteur Diagne ñu bari complain nañ ko personally man experience naa ko nga oote pour ñu am nit ko xam ne am na signs symptoms wara borom ñu test ko sax yéen seen boppa yéen waa Ministry of Health ngeen yónnee ko result am ne ko test na positive mu am pour toog kiram ak njobootam few hours pour xaar leen ngeen jël si ko because li ñoo bañ mooy feebar bi comme ni ngeen ko waxee yéen seen boobu ni ñu ko understandé simple droplets soo nekkee ak nit possibility bi pour nga jox ko dafa gaaw so léegi te ñun suñ settings yi suñ kër yi nekk boo xam ne fii ki la mun a wax ne moom kese moo dëkk kiram bariwul de ñun suñ social settings yi dafa dañ jaxasoo torop léegi lu ndax yéen lan mooy seen jafe-jafe ba nga xam ne buñ leen ooyee si 1025 bi weekend bi moom 2025 bi moom doxul waaye léegi wax nañ ma ne is up and running waaye tey ba tey soo koolee 1025 bi pour ñu ñoo jël si la problème la ba suba loolu problème la ba tey capacity ngeen amut ndax amu leen room si hôtel yi foo leen dugalee nit ñi ndax amu leen ambulance yi gis nañ ambulance yu bari yu ñëw fan yi lan mooy jafe-jafe bi pour Gambien ñi nga xam ne ñu ngi seetaan.
Okay, Fatou, so thank you. Just like I said, the more patients we are having, the more we are going to have delays in people being picked. And then dina am what go hamne hejna sax dinga call, but because ne kenen kuñ ka call kuñ ko mo gëna febar ko mo need attention more quickly, hejna it will take you a long time bala nga nek ci queue bi because ñun usually we prioritize suñu call even some people dañoo call so ne if they call my phone, usually it's not the 1025 number they call. Man, usually it's the rapid response team number I call. But I'll tell them the state of the patient, and I'll few things I will have to ask for. New one there, the patient needs urgent attention, and then they will tell me a number of people. Red Cross can call, rapid response mun nañu call together, community mun nañu call. Then I'll tell them, okay, 1, 2, 3, 4 will come first. Then 2, 3, 4, 5, 6 will come after that. Then you wait whilst you look for space for orders. Because as you can see, it depends on when you so now you and symptom, then you test and you are positive, you seem to be at the priority number 3. Okay, so mild symptoms will be in priority number 2. Acute symptoms, and not test because I want the results again are good, because that person is the one to be in priority number 1 because Kokomo needs help more urgently. So what we'll advise the person is that try nga isolate sa bopa moy na make sure sune yang si kid bo xamne at least you have 2 bedrooms yo nga occupy ben and ñeneen ñi nekk ci benen for the time being until we get this thing done. Then ñu la make sure nga am mask ñu la make sure ne ñu la wala jegeñ xam ne this is what's going to be the situation while to make arrangements for you. You can imagine where you have over 100 and something people being positive in one day. You can imagine getting to get, even if those 10 ambulances that they've given us today, we put them all on the road. I'm not sure we can easily go and pick everybody up in their houses. Even if everybody from their houses, it's not possible for us to accommodate all those people as people are already accommodated. So you need to either look for new accommodation or you need to evacuate those people who are already there that are due to go home and clean the room, disinfect the room and clean the room and make it possible for other people to go in. So these are the limitations. These are the things that makes it difficult. So it's not going to get better until the cases comes down, because the more cases we have, the more we'll need more people who are more sick, and we'll have more people that will need more attention. And then you'll find out that just test positive, they will have to wait for a while before we'll be able to give them that priority. So ñoo xam ne am nañ mild symptoms, ñu am moderate symptoms, ñoo xam ne am nañ severe symptoms, ñooñu la ñu njëkk a jox priority. So that's always the problem. And then it's not only pour nga dem lopitaan you just not going to go there ñu ne la room baa ngi ni nga sedda foofu. No, you need to have a place boo xam ne is secured, is safe for you, and then suñ la soxlee if condition get worse, we can be able to act on it quickly. You can see that there are multiple places that people can choose to say, ne am na hotel sangam mun naa faa nekka ndax mun naa faa dëkka. I'll tell you no, because so fa nekkee so am any problem we can be able to find out, and you cannot reach us on time. So it's best nit ñi get naa jegeñ fu ñu war a nekka and fu ñu mën a access. Then so am a problem we can easily find a solution to your problem quickly. Then it won't be that yaa ngi hotel comme ne hotel rek wante so am a problem we can be able to access you. So those are the problems. So rapid response team ñoom ñoo dee jëli nit ñi, and sometimes it's not even rapid response. Nit ñi dañoo call du sangam nii lii la am. Sometimes they are not even tested yet. Dama ne naa okay ñëwal place sangam, and I'll call the place to tell them that key is coming with this 1 2 3 and lii ngeen ko war a defar. So you see those people get ready, and then sometimes we pick them up, sometimes they come by themselves. A lot of times people even family drive people to hospital or to treatment center, and people act on it. So yes, some people choose to want to be home, and I think that's not a bad idea. We're not going to discourage that. So how many for you have a good environment for Munga and you're able to monitor yourself. So you say anything that's worrying, munga check the temperature, munga check the saturation, and then you'll be alerting us as and when something is wrong. And then as soon as you say something is wrong, we can be able to access you wherever you are. So we have contacts of all those people. So we won't discourage that for asymptomatic patients, and they have mild symptoms. But as I said, people who are quite ill and critically ill, those ones we have to find a way for them to be closely watched.
Yeah, so dinaa ñëw si kanam si healthcare workers yi, but I bëgg naa ñu wax about people ñu nga xam ne they are critically ill. Dr. Jagne gis nañ ne fan yi moom dee bi bari na trop ci Gambia, COVID related, some of them, most of them, even the numbers démba rek tey numbers yi ñëw tey gis nañ ne 9 people. That is very alarming. Most of feebar bi tam lu ndaw liñ ci jàng mooy ñim dee gën a sonal li leen dee dal mooy breathing issues, te buñ dooree di am loolu rek boobu dafa mel ni xëj na symptômes yi dafa xaw a graaw, te nit ki nag bu munta nokki nag boobu fa la problème bi dee gën a métti. wax nañu gis nañ we have come across so many people dañ laa wax ne suma nit ki feebar na amul oxygène, mënuta am oxygène pour mu breathe, mu ngi am problème lii tax na be ñu bari ñu ngi wax ne lii moo tax dee bari si dëkk bi. wax ñu yéen at the treatment center what is available, ndax resources yu ngeen soxla pour treat people, because right now cases yi bari nañ. I'm sure ne people that are critically ill tam mu ngi increase si seen treatment centers yi, ndax am ngeen available resources especially when it comes to oxygen ak yooyu noonu pour mun a saytu ñi ñëpp mun leen a xool, because numbers yi nu moo demee is really alarming.
So Fatou, thank God people are just noticing that. Then it will never be enough. The oxygen will never be enough. Until we are able to cope this outbreak, we may never be able to have enough oxygen. Imagine you can 15 liters of oxygen per minute. That is how bad it can be. And then some people will have to be on a CPAP. Even with a CPAP, they still need 15 liters of oxygen a minute. So meaning could not need like 3 cylinders of oxygen in like 24 hours. Sometimes some will need 2 cylinders of oxygen in 24 hours. So I made 10 of that. You can imagine how much oxygen we need. We have a lot of oxygen concentrators. They can give to 5 liters per minute. But most of the people who come very ill, it cannot help them. So we and sometimes some are so hypoxic that even if you give them oxygen, the best you can get is around 70, 60. I mean, you give them the oxygen, you can see that you're giving them up to 15 liters of oxygen per minute. They still are hungry for oxygen. And some of them move from where they are dead.
Wow.
So yes, I mean, at least we have in the past 1 week, like 4 people with that kind of a situation. They come to the emergency room, they are not even tested yet. That time, I'm sure you saw on the stripper that the people are they are dead. They are dead after they are tested being positive.
Yeah.
So some of those people, they come to the hospital before we can do anything for them. Their saturations keep dropping. We'll give them oxygen. They still continue dropping. And even if you, before you know, in 1 hour, 2 hours, they're gone. You know, you whatever you do, even if you put them on a ventilator, you cannot stop those people from dying. So you know, then start counting your hamne. They do well with oxygen. You give them oxygen. Some of them will need 10 liters of oxygen, 15 liters of oxygen. How long are you going to be able to keep them on this? Sometimes some did that for 2 weeks. So at some point, if more people are getting to need oxygen, more oxygen will be needed. At some point, we'll have to now prioritize. Yes,
Doctor,
it will come to that.
that is scary.
Yeah,
That
it
is
is, and
scary.
that's how I want people to understand it, because I don't want to put an impression here that anywhere in the world, everywhere in the world, that's how it goes. Okay, Manayo maybe you them 2 of us are lying down. The doctors have this critical decision to decide can manage without it. So that choice will have to come, because as more people are coming, imagine if you're needing 3 cylinders of oxygen in 24 hours, and you have over 30 people or 20 people. Let's start being on the moderate side. You're talking about 90 cylinders of oxygen a day. And 90 cylinders of oxygen in a day, forget about the oxygen pots you are going to have, because you need to have all the flow meter. You need to have a place for more patient water there, oxygen, and then somebody could monitor. Okay, then that oxygen is not doing for that. So they will need a CPAP. With the CPAP we have about 14 CPAP machines at sanatorium. Currently, only 4 are not in use. Only 10 are in use. So you can imagine. So if the more your need for oxygen increase, the more your need for kind of machine we use for you changes, and then the higher your chance of dying if the oxygen, the machine is not able to support you. So I think what we need right now is that people have to just wake up from our senses, and we'll do everything we can do to make sure we prevent ourselves from getting it, especially people who have comorbidities like diabetes, hypertension. Diabetics are really bad.
Yeah.
Yes. And then people who are elderly. Okay. You see people, Mary Johanna doing care all the while, only for their children to come and bring it to them. You know, you see, mom, all this while, is in his house. Or my mother is not well, before long the person is breathless. So we pick the person up, test, and it's positive. So we have to, people just, this, I'm a clinician, but I'm telling you that the treatment is not the bottom line. The bottom line is for people to be prevented from getting it, because the numbers are going to go more and more. Out of every 100, 20 of them will be severely, will be ill, okay? And 5 of them are likely to die, okay, with even the best of treatment, yes. I'm just telling you. So even if you look at the numbers we are having, that's why the numbers, as the numbers of infections are getting more, the more people are getting sicker and the more people are dying. So ventilating oxygen, those people are definitely going to die. You cannot stop them from dying, because the injury to the lung is so extensive and their reserve is so small. So definitely they're going to die. So the best thing is to prevent them from getting there. So the community is getting scared, good or bad, but people need to get more scared, because we may not be able to sustain it. Even if, I'm telling you that even if Barrow decides that all the Gambian economy is going for COVID, we can't have enough for anybody.
Yeah.
If the numbers get more. Imagine if we have 100 critically ill patients who need oxygen, all of them, 2 to 3 cylinders of oxygen a day. You're talking about 2 to 300 cylinders of oxygen. How many oxygen vents are you going to have? And who are going to monitor all these people? And other medications are aside. It's not only oxygen you're going to put them on. So you can imagine it. So people need to get ready. We need to get to understand the magnitude of the problem we're dealing with. And when we say people should stay home, when we say people should go out when it's very necessary, when we say people should prevent their elderly people, this is what we are talking about. I mean, I'm worried. I get scared. I can't sleep at night. I take calls at odd times of the night. This person cannot breathe. And anytime you hear that, then that is the extremes of issues. Then next I'm calling the ambulance driver, I'm calling the medics, and sometimes I call sanatorium. I mean, we have to wheel people out at night and tell you that you are better, you don't need oxygen now, so we're moving you out of this place, taking you to your hotel. Then we give space for other people to come. So you can imagine, I mean, at this level, I'm telling you the past 1 month, 2 weeks, what has been happening. Sanatorium gets full to a point that the symptomatic people we think are better, we have to move them at the middle of the night to create space for others. So I'm just saying this for you to tell your viewers so people will understand the magnitude of the problem. I am not exaggerating it, I'm telling you as it is.
And I think
so that people understand what's going on.
It's important for people like I'm scared myself right now hearing this from you, and I'm sure so many of my viewers are also, because at the end of the day, the rate we are going, if we go in this rate, no infrastructure is ready for this disease. And that's the hard fact. In the US, every single day, with everything that they have, but with our new mega resources, if this is the rate we are going, this is really bad. The reality is really bad right now.
We understand that the magnitude of the problem. We are Gambians. We are good at the smaller piece of things, like fuñma jugal nehuma, fuñma tedal nehuma. I mean, leka yuma jox nehuma. Man fi man ni mënuñu ma call te lekuma leka buñ ma jox dafa am kani. Those are things that we major in. But I am worried about the fact that people who are coming, they may come at a point that we cannot help them. Often at night, even during the day, you find out you call and the ambulance is somewhere else. Imagine you send an ambulance to Mandinari or to say Farababantang, and you send another one to Brikama, and somebody is in Banjul, you need to pick him up. You don't expect that to be in the next 20 minutes, even if the ambulance clears the road. It's a major problem. People just stay away and stay at home and do the precautions that they need to prevent themselves from getting it and giving it to people who are vulnerable. Because even the young people now are getting sick and very sick, not only sick, but very sick. So you can see people as young as 19 years, 18 years. I mean, they're having symptoms and very, very bad symptoms. So, and we need to get to know that if your inoculum is high, your chance to have symptoms is very high. Okay, and your immunity, nobody can guess that this person will not have it or this person will not have symptoms. Anybody can have it.
Wow, this is really scary, very, very scary. Dr. Buba, Dr. Jan coming for thing, silanya warta, na situation obe tembeda minto, silanya warta, and akumaya ta mobe ya long, bi munon na reality. Bayri itolebe jararo karola. Akanyin kumo dolfo ntebe mirakang mol min kafo imam paracetamol soto mol min kafo bari modol mfonga e badi ngol soto nga mol soto mini alonko wadi soto ta ilafta puru hani niji rango akoleata mimu oxygenti ateba fukang biti lola oxygen kamo killing fon tarandi oxygen kono for 24 hours how akoleata nyami sako ka mobe tarandi woto lafta comme Dr. Diagne min fo dron jara rola karola ka mol tarandi ni oxygen woto aning fanan a mol nyanta mun kala ka lonko sasa nyinto nyato nyambe tembe dal to mi alonko nyuno na reality fonga diamu mol ye nyin kangola ya long munebe kirin sasa la karol
Apaka pati patu mbeta fulale adumba seinkana nyunkuro atata andata tankandirodro tankandirola bunda wole kubmata ni tambita tankandirola fo tata dum jankanyi sifal bimfo ye courant soto fatata wajabi ila kufuka fo data mantoro soto fo be dundi la nyi oxygen fonkol kono e bayila ko sila o ka transila mbutum tiyaru data so wala tinna pour be bol be danila adin tankandro ala fannali imam ko le abaki follow ye maskudu wati hite be fintila finti ning atara unnecessary ni wolde sabati suwon yaajele walla jamfa ka folla alle jamfa nyola nalbe siri yaaje ibulo kunin jiyolin safu nola nabo meme tabukula wani ko e ko joli saburo wati de wat ibaya anne yatala ibulo edulama ibulo dota indo iye tuma o kukera wande bodo e blutira o so yatale isakara kura keso hanna da be bola walla wati min badi karadaro min ba hand sanitizer ikalama yadi ni fanda legi ninka min ya lonko ninge tamadu dron iseke moti bi ya lonko ye fawtaka yo mero min be suoko ani bo papi min be suoko abikata lado yaje ise wol takandi kar niti aje ko ndem ci kanawde ndem fonkolti ndem laaji kurawle jim fawban soto ñi be ko ñi no lañi be fonkol la
aka kebal da malamuta
aka kebal
da malamuta
aka kebal da malamuta jim banke fondi ke fenketi sai fo cheba ñi wala meta topoto te futata te andi te fondi ke fawnse ñi foye ko aka fondi ke muta ke fa
docteur Diagne wol fo sai ako mol bi mel
ko fo kay ha exactly bo fo ke te funding ke ete min jigita ko ete sembo sutul ete be fenkere ete man faale nyinay i jate dam ta jat ke dal pour fatu akatale fontol ta dolin kata nimbe bol tala pour ke sika ke samba e dale ka fo be keloke e ka fo be keloke la bom kata sinka fo fay bari fo ni be atike kala buta bal yalon ro même ta kunari comme ça kala buta bara ba ni ya lonko modbe ni gadio min be itoliye tuti tol fo makoy wallahi wode be ro fayda boka de buna be abisa abidala e makoy ni sa sara sika du ambulance ko no samba atembi ya lonko anini pour fanjo gata nyoka abidala ba fala in fele du karali in fanan ko andu side thing comme ça di wati dato ko ko le ata kenya me sa to siada fasiada ngaje ko mu jama silang ison do mol farika ibe sonka bari malla mu ngafutani mucholla fatu niya ko si Gambia la response kundinde bari Ministry of Health aninna partner sol nim mini bebe ko no security bunda lemba jata kende ala bunda lemba ning jata kende danda support la WHO ni UNICEF wol na ning ko na kato ala la demaro kama ay na fasotale katun ba fale niya den tol Senegal en tol muru le jula sabo bela wala kesi sol tatale wili tanning killing katambi wala Gambia nyimba kundu Gambia dun julale soto ngana points of entries ngabe mutale bari Senegal ni Gambia tema huwal le bije dun julale bije minye ko julale ka dun julale ka dun moyka so ba ko ko fo ko la keba be mara kay wo be ka fa handi du de sa ne ko le mo ko sa ta ya taw fo no ngi sama wo do li ta te taste quarantine plate ka te ta ko nimbo sika ko do limbol ko na fele ten be bu chomi fa yalo say ka wili ke ne tan ko Gambia episode ni don be wili handing killing wodo Gambia akata bakle ba so kuda akata ni jara kenda bol ka jeko ni kuro jay control ni atran doli wato mi nga nyafu iko ngamda anyafu ni la killing e ka mo killing mo saba mo dani o yaso nde yamu ka mo le wato mi da wato mi be balanka kaje ko nyimman soto nyimmi fek datara wo taybo yatara num saybe minnaten ifo mol sontanum ye far report nan ye fal sambana ngam min fo tankandiro gurnal yol fenge a funti kuto mol yakatale bulukol be keri mol sontantole mbakan tankandiro be keri atata nyato do mandindro mo kilul min kata social media ka mol fo ka mol sondo mol jagasi mol data relax yajele o relax ko ron ko le jemasi bo sambana so natara num kabiri a findita num be nyapita ka nyame ngalla mo nyula nga tempu yellum tawje mamin kalawlo ya bondije ya fo mole huwol mutata digal mutata sate mole be sulala tol fo lan be kapu joma kaje ko nying yeboje binnare la digal ay kuro samane te fon fe iko ko babo because ya londe isi nyola iko ko mabo e fan feje ete malon ko wala o mabo mu choko na bo kuro dilete la ni dibal so be min fora mo dal nga o kala mutabang yeboje mamin kalawlo dukare afai hada baya ko da eta da quarantine wala ayta ya fantastic yajele isaje bese tanka ni ko tanka ko bundal kan mil fa ala mutaba ni ko findi ndara da bando ko fidu ke mutale mbala ala fidu mo sis la hadide ni mu tu fol ba ko mi ka ndai ko lokol e bita ndai ko pote be be kraje be fitu fata ray iko sikawol be ya sa ko ya di mero ata meru mata bari tan da ya bi meru te be meru fe mo fight for akaba si so be dia bla mole dibe dia benka ka diamo pour asedun sondo mol kono pour ga yo fahamu ndona ko be community be kilde nan population anin public be mu kilolde nanganiyo mu minti way ka tol tankandi ala la demaro kamanga ala dani face en courant bondi molka so tankandiro ngono ma ba janni ba fala positive talen keketa janale yeta jana o katra sidan ko tijata de ba be fala andu jaja ko endalal ni tara foyete nyin soto silan itata foy fatata anoda level dame yalon ko silan te kurala bandara gol findita kuranji sila tata fo sila ku ka fo jim dunyo kono fo sayte kas fo nyite sulata wala ba tabale ba jinna isila o awta ko ladal alinga jennira banga bala faji merole halite fondinke ye bala fe fo e bang ntol fo mu me kafu nyoma nin kafu na nyoma am so nga nyoma ko dron ibajila abijala bukaka selele ibajila jita yuf nimbe wala jam abeni China le China mole abra China kurale yajira abe China be faka be Wuhan be faka be feka ikafa wole die loi landi iko tay mobile kata ban wole loi respect na modi fo ta ma la la gandaro de kate da kalifa ite be ta ma dula wole loi mi landi ye don lockdown ay wati ka si ike lockdown adu ko bula je ka respect le si ni na ta gambia te loi dubi ata je ko to buja nka jaare ke mari dibe akafoni fe bakre jete inkila ndela hotel o frigo nyata la jande fo gol nyata bude ta ko fiyo jinde ko wala biya ete be kumbi ete be tangala parce que da ko do ni la pour que te ko hotel o to ke ko la yeto ko to pour da ko reni di bal kana pour fanyo ayo ka courant ni tanka ayete ka jolle hotel jisba pour abe kala frigo ko ete ko wala biya fote data holiday la fo mum ina tela molle jibe ngi sabati jilakle oto sabati ba gambe no kala fi nying kisikirin dingul kaje ko kamo kajafi kamo imanjinke iman fenketen bari ta jibe la umare ku kendol binke kaje pour que te tankan lafsanga o muta nyo fe bang nga fata kanyo kajafi kanyo la kol kisikisi dame yalo ka negative tale let's have positive mental attitude aliga kata bang da mirol akata nim positive vela nga negative jamfand ninka mira positively baby ta nyatole ha positively always positive front line sulbe do ko day in day ay front line do afamata soko no kundare amanta soko
wallahi
bede ifeto ko to ikadu ko ke 24 hours ibita do sika jar do samal be to sika ko ko sika le be wato e malika mo le kan sika eto mo fata mira ba kati ko mi ke ka fatu foti wasale yo tetu ko ndumi bibere front line wal matra ko do mira front liners coming up to mira wala kaje ko na banko etanka ngana je ko yeta na sol ko beta sol ko al halo ne ngura banke je ta dugati katum be sabali do kane dol bije mo fula sababe ba bunkilinde saliba kilim be ka wala siya so wala dan ton kay jurale mira pura kana futan na subali kono nyimbe fula suba kono do tarafata ay nimbe ba dila jola yajene nka jele tankandi gambe no la linga kafu nyoma ba momo etela mira ko mu kudoti o landi folo nga kafu nyoma be ngani akilin soto ngani kuran kele kurunda subali kono nyin kana dunje ne dunda subali kono o nyama namo a controlo be ko yala ha nka kudol mbim fo be fo manyi soto fenketa jane manyi din tele manketi jane nti itina o fo mira la ko tek ibe complete mbim fo la pour woyo dira do fo man tora so wala atinna linga kata nkana futa o stage nimbe kafra nyoma do rebaji la jinjita yuf labe yom fata uranji yeta ibaji la killing dro le baso na meta be troifa control bezo le bedina e wala na kala chana kala fo ibane la jula le ta la ndo tabi afele ta ba ku dimba control 1000 do wala so senegal do wiri tanni killing feng so you want to ba senegal min kafra do man ka min faale kan dro la fanna beso do mol fo yande do nkara sare do kama nkara do kadafi nkara do kisi kana ko do fo do biya do ko be o bila ta si do bali al kete ite mari le pour la kan do kama e kana si bo franka de ba kadafi la do ko ko fo ba do be mu nyala da hadu ado ko ko ta malika hadu te be kadafi wala ro ende fo ite ngadi do le so ila ngandi o landi fo lo nga kafu nyoma na kuro nyin kele na banda momo be mi kele sake ro barel salon ko hadama de momo ite fem fo moma malaika fulade dobi je ba safira al kame ko o mari le makoy bari jandi be futalo al nga nyoma ko dron be kafu nyoma ngay pura nga kele aji asejino alkana sila de
asejino
bal sola courage la alkana asila asejino inshallah nin ka fla nyoma nga tankandro bundal muta ngal moy jata kenda molle kam minfo wol ka ku kendo drone fo tankandro la fanala dabule chola guidelines sol bije ibayla nimbe o muta nyo fedro nyimbe kala yuf mo be free Fatou
Tonyal barka bake buba hukuma ta bake Dr. Jagne fi ma bëgg ñu ñëw rek mooy wax nga fi lu ragallo suñu reality and I think it's about time Gambians yi ñu xam lan mooy suñu reality this was the exact conversation bi ma am ak national coordinator bi he was blunt as it can be and he gave the real scenario and it was very scary for me and I know ne Gambians yu bari tey façon conversation bi ñuy am nii am na solo Gambien ñi déggee ko si yéen ne lii mooy suñu reality affaire bi jaxasoo na tuuti waaye nag mun na ñëw down waaye yéena si lu tax feebar bi mun na ñëw down mooy ñu come together as a people ñu fight this is an enemy dama ko dee wax soo demee si yéena dëkk comme Sénégal dama dee wax ne gis nga when it comes to national interest xooluñ kii kan la kii kan la kii kan la they come out as a force ñu ñëw together pour ñu xeex ko and I think that should be our force going forward COVID ñëpp a si war a bokka feebar yi problème yi ñëpp la du problème yi kenn because kenn xamut feebar bi kan la moo téye kenn xamut kan mooy mucc si feebar bi waaye nag benn si yu nga xam ne mun na tax feebar bi ñu mun ko contain mooy précautions yi ñu mun a def mooy raxas suñ loxo yi sol masque toog suñ kër yi ñu toppa regulations yi nga xam ne Ministry of Health ak WHO tëral nañ ko si réew mi tey ministre bi moo am powers yi pour tëral state of emergency yu mu fi tëral health emergency su amee si réew mi moom moo joxe ndigal ne toog leen si kër yi def leen lii gis nañ ne nag masque ñu ngi ko def compulsory si réew mi ñëpp ñu ngi sol masque waaye nag masque yi war na mun na jur lu bari si réew mi si niñ koy def Demba suma xarit woona ma Westfield mu ne ma dangaa gis kuy jaay masque mu téye masque am man ma ñëw rek ne ko masque laa bugga ma ne ko xaaral ma tes ko ma jël masque bi sol ko tes ko ne ko dafa tuuti ma teg ko mu jox ma beneen ma tes ko man mi tes masque boobu ndax man xam naa ne am naa feebar boobu su ma paree bàyyi fa masque boobu keneen ñëw tes ko sol ko dem keneen ñëw tes ko loolu ñaata nit ñoo nekk te yéen docteur yi wax ngeen ñu ne feebar bi boo ko masque bi soo ko soloo xëy na sa droplets nekk ci keneen ku ko sol mun na ko jël am na ku ma wax ne am na yenn taxi driver yoo xam ne boo duggee seen oto yi dañ jël seen spare masque buñ jël rek ñu aj ko si biir yow boo duggee seen moto yi xam nañ ne police yaa ngay ñëw ñu génnee ñu ne la jëlal solal balaa police bi téye ñu nga sol ko boo la rombee police yi ñu jël ko rek ñu ajaat ko ñoom noonu la ñuy dox suba ba ngoon di liggéey si façon yooyu noonu foog nga ne nag yaa ngi bañ pour police yi pénalise la war a nga fay fine ak yooyu noonu waaye nag yooyu noonu ñuy def practice yooyu noonu ñuy def mu ngi lore si dëkk bi te loolu am na solo ñu waxtaan ci feebar bi luñ ko war a suñ ne ñu toog suñ kër yi war a ñu sol masque waaye suñu soli masque yi si façon anam yii ndax yooyu dinañ mucca si feebar bi docteur Jagne
so loolu anga dëkk bu nekk ak feebar bu nekk o lu am rek nit ñi dinañ jëli ku nekk dina jëli si ay jikko comme jikko Falkunda ñoom foñu ut leneen rek luñ teer rek anga ñoom ñanga ni fala ni loolu fu ñu def ko so da nga gis ñoo xam ne sax dañoo jël masque ñu sol masque ñu takk ko seen baat bi ok o ñu def masque bi mu nekk seen gémmiñ bi bakken moom mu ngi fireeku o ñu def masque bi ñeneen sax dañ ko def seen bopp bi suñ gisee ñu gis ku la laaj ñu xëcc ko ñeneen di wax ne man mun maa nokki am masque so loolu yëpp is an issue and then soo lee dangaa jaay masque nga am ko si jënda I think it's best balaa nga ko sol nga fóot ko ba mu set nga the cloth mask moom the good thing about it mun nga na iron you can take an iron nga iron ko waat fóot ko ba mu set then nga iron ko waat ba su nekk mu nga def loolu soo génne rek nga solaat ko nga génne loolu am na solo and then sometimes the size of mask bi they use da ngaa gis na mask bi du dee mën a cover seen gémmiñ ak seen bakkan bi yëpp so dafa nekk lu ndaw and yooyu yëpp dañ ko war a xool I mean loo xam ne mën na koo sol loolu you don't need to put it on your face. It's not for sunset. It's to protect you. So I mean, I know some sisters in they're more concerned about color matching be and the foreign yere bu ñu war a sol ak war a match ak mask bi.
Wow.
It's not cosmetic. This is a life-saving process. So soo fa demee utal boo xam ne dina la mun a age. Soo ko jëndee don't even go in, you can even put in a bag and keep aga kër nga dugal ko si xooj ko si ndobu tànga then nga passé ko and that's it. Ndobu tànga moom soo ko mënee dugal si biir ak omo that's enough. te ña soo su ne oro sawel di nga génnee chlore bi or something but ndobu tànga baax na def si omo nga dem like mu seeda den nga raxas ko den nga iron ko den nga solaat ko. I'll advise that soo koy sol continue di ko sol bu ko génnee because amul benn njëriñ nga koy amee sol ko tey or sol ko léegi ni nga bàyyi génne nga génne ko. It has to be there with you. So that is the reason why nit ñi génne bi dañ ko war a wàññi.
Wow.
So only when you need to be out si nga koy sol nga génn. Soo toppati sa soxla nga dem delloo foo jógee. And then leneen tamit naa ko ci wax mooy ataaya bi mooy naka lañ ko dee waxee this Café Touba and stuff ñu dee jaay si yoon bi.
Café Touba.
Yes. Kii jël xeli si mu may si kii mu jox xob bi keneen ki tamit jëli xeli si ataaya the same thing or cigarette ngeen nekk si yoon bi rek kii tuur rek kii ne ko may ma si ñu joxewaat anga ñooñu those are major issues yoo xam ne dama ko dee gis si yoon bi and these things that people have to look at it seriously. And then campaign, boys yi di nañ toog si kër gi démba woo bàkki démba si guddi maa ngi génn si biti suma moto bi lampe bi mu taalee rek ma dégg boys yi ne oto yaa ñoo tiital de maa ne yéen da ngeen war a dugg si kër gi ngeen bàyyi si toog si yoon police yi ñëwuñ ngeen dugg si néeg yéen dawantu bi it's not good. People have to stay at home. That's what we need. No kenn amul jot boobu noonu ngay nekk di waralu biir Banjul di wax nit ñi ne bu leen toog si yoon bi bu leen dem tëg. It's not necessary. It's only something loo xam ne bëgguñ ko at this time moo tax nit ñi ko def. It's a lot of money for government. It's a lot of discomfort for these frontline workers. You buy send family at night, they're roaming at night to make sure people stay at home, and then roaming around during the day, going to shops, closely, wouldn't talk fee. All those are energy consuming. If people are law abiding, you're doing your app. So I advise that people need to this thing very seriously. Before long, we can just see the end to this. But if not, I will not give you hope. Now, with the attitude being amelegi, and the kind of things we're doing, we may be talking about more oxygen problems. We may be talking about more people being critically ill, or somebody neki dan na sikiram dena, or ki nyinko feka mungi desi plasanga. Those things will not stop until we change our attitude towards it, and that wouldn't go prevent. And so, dege ngane joko oxygen, joko medication being because feka na accident for funun. I'm sure you've your own ears. Dinga dega diw sangam dena sikiram ki jël nañ ko suba si jog ne mu ne mënta nokki ba bala ñoo fekk dena. So those are things that happen with COVID. Not only because the COVID mo la rey, but because the health system is going to be choked. Some people cannot even have access to healthcare right now because if you have a lot of our concentration on COVID, then just yenen fanay are going to be limited. Nit ñi mënu access those funnels, those areas. So there are going to be another limitation. So not only COVID killing people, but so legi nga am pancreatitis, acute appendicitis. Doctor bu la wara operate. Bala nga aga fofu nonu ñu screen langu. Ñu ne dañ la check whether you are COVID or not COVID. Bala bobu nonu ñu move from there. Doctor bu la wara indi, and one of them, two of them are under quarantine or they are under treatment. The numbers are getting less and less. Time before the urgency they used to give to you, it's not going to be the same urgency. And your recovery depends on how often you have been acted on. If you don't have myocardial infarction, you're having a chest pain. But I'm not myocardial infarction, then you check out COVID. The time is important. You have a stroke. But I'm not test now or on isolation fee. It's all delays. Those are all things that are adding to the people dying. And it's going to continue until we're able to get an end to this.
Wow, loolu am na solo trop docteur Manja lafta comme nin docteur Jagne min foten drong moluka manya kenya mi bayri ngalon ne ko ni ko mask fenno mi alon ko akumata bake nyin sasa ka tanka akumata je bake bar bi nga min je wolom ni mask local mask ntolla jang wala siata jang molka local mask le gena use ala security kumayata bake bayri karalla le ba karala wo karalla fo testa le ban muna mala status ti malom bari se jiki ko fan wo fanan fisiata le bari ite min nata massang inata massang ye mas nyinta docteur min folom inyanta sambala sokuna ya ku ya pasi isina dung bari te masan damin drong ikombatu nga test fa be silan nale ya ke nungoto ya ke ya landa o man kanya yo landi ye dota yo ke nungoto wo sifa kamuna ke molla ani nyin kamba ni min katara sirin vuto ye ataya kasi kilingo ta ite ami ya pas nyin dola ye cigarette o saba fo halfway ya di nyinna cafe tuba na di ngol everyday ko le foy nim futara silo ke ko dama jinda cafe tuba ko cafe tuba mun to cafe tuba antela moto kono because at the end of the day these are some of the little things mi alon ko buke hakilo toto bari wolle se ke fenti min se taria kanyi sa di mo
Fatou ko nyimbe lari wala jama ngamra gradually mbe kol je kanda I am happy that you know ite fanan fon ba je kante nyame ngalon jama fanan do man do moy ba je ka wala nyam ya jele follow masola yusia niko maso use nimba use ajanta use la nyame aba propose ni aba defeat la
ha
ya understand kan ko je o fota ma de yalo atleta zero doli de maso ta akatre bala da ko to puru police kane mata silo ka police fi dino e kaje ya dadi ko bon ko da mai bon
ha
yaje isaje ko maso be bulle de bara mantra yuska yaje wala maso kare bulu ye da mako ma ye dum bula ma fala mo de kare o be anke ma nya ti biya ko abita kan da ko adun ka boy nu to kane da abe ko ma ni be fin be jama ko wala be kuran keso nyin tankandla maso yusa manke façon ti manke ko pour ke dama fawle ñiñandi façon ne ndena maso ñiñandi le ndetama ñiña wonte de propose kiline bala wolem ke tankandi kuran keso la c'est que e bantan biloti eteni kuran keso tema because na fintita droplets ni wara virus ni abina tumando abina ñine mala ay jolong ate futalela etandi jila e duila a propose molde amanke façon ti amanke pour ko e ka ko police le kamahani ni yadu akaboy ndula kane dala be ko e ka dol fananje e ka tay ka like jalo say lual sota pour janni be du nat business plan walle bita leptano kono foye ma sodum so esa ye doyena mo jamaay na dole dasa ite dum yela hajo tamande na yafo dukare abal masalifin in fula fonkola ite fana wo tata yo du yeta ko do la hajo e jara bar siran atul man ratankan drol atul ba di ka nyola dukare se fata se fata o manya sifal bela sakata ngol bula nkana nyofu maso nkana maso te ya taste ya landi ya fenke janendo ol bemu fo ya da betela ite o to para do da o sanna ya du ka fata o sima ite nyimmi fu ite malo fo te aso ite mi fa ya fu ite malo ya fu du fo ya aso ba isi so sai ite o maso du instead of a eta kandi abadi le la wala maso du no hanu ta ko no te ko maso ya du ila maso ya yani ko alhalu falinta kare ru falin ba e masduda bo fala bo pu min masoni inte ba beta la kane ban to yani maso pura ke ba ganin fa ko kare insa du anyanta du na nyame insa falin ya abetema insen kana nyofu masola ino nga du adu nyaay betea nga fata nim cafe tuba be al kafoten cafe tuba saul ite ba min nanke jara do alsa be kerin bar tolle public health o luasi fa yalo public health emergency regulation o membe findra minister sembantu yala o sifal dinga ko man toro le fentem ba be stop lan dol bit the time for always la o sifal fo jandim be bolani ko nyin kono ka je ko kanata le ite cafe tuba wa fila sina fendi bar ite cafe tuba wa fila anite mi ka cafe tuba sam mba fola le combina ko cross la kaje ko bondi system ko follow because am fenne dindo am ite oboje ite alo de fanya so fanya baso You see, atabul nga hakilo to atabu to ba. Ini de lafta atal sifa ya him ya ming. Bari be atabu ite ndongo jamal albe siri nyokan al kalbe atal la ite kasi kilum kasi fulal katara. Ya hasi ya dinna mi dombe ni fulal ya wala kasi sero mi. Duro bra ni don la no ni don bota. So sai dem apu no be jinete ota. Rugal be yo hakilo bra dika. Fatila invite ya. Ni kumara because it is sensitization. Be do kala mutandikan. Ni mu ñokoto dialti kibarol la. So pour la fa mo be la fa ni mu ñokoto dialti nka ko min fanya. Bando do be kadla do le subi suya. Baro be pour ño tankan do kolam. Pour be se tara ku ko nga kanani kurala nga wujo nga ko jindi gambe jaay ta asekenon alkana silade inse dani nga ala dani baki nga ala dani pura jindi barako ala lafta puri mari ye katake ibe kata kule kala sababu ibe sababu le kala dol fana kata je babula ko kura nga dolije ibe kura de puri be quarantine ni lafta tale la boni ko mas du ka e nga ke balen sabana janno bay kura tentel ete ma lon ka del addo wol doli nin tate tes dro etara kura keso o kilo le kana ko dinda dimbal be jawol na ke ali samba jara ali fenke jana isi a tara sila ite fete tama ya tale ko kura te ko fela na te so te sonda so sambe wol kana jikim fono ko la ko ite le moti biya lon ko ite imunta ina la ite ten sot la hanire ni se mom mutale na diploma le kana dol bije e kabira ko okay diplomacy fawta intero kura ba wala diplomacy yala bawlo
na banko kan fo bi maje na vice president sasani yama minister ya lonko the most important ministries or minister of finance agriculture ibebe siri bankende
so say nimbanke yukura ba molo nimbanke kon kete jelete ite momi yalo ite tamala nka nyapi kanden ke batande hani kura yimbete tamala long ite mu jumalti ite tamala nying intol interest la because of epidemiology epidemiology wolem kura inna janjaw jama kono ite exposed ta dame ipona dame intol tikta ko kura ke so bijere ambite tammo ko teri molle uke ite molle kur fanya nyoga to ka jama dieta mare gide mantrete gibele ko tambi jode ite mu classified ite mu gadar to mangi gamlete buntu ali ngaji be fote ite la o tabu ko le pura ni asika formasi na interest mu walti so do fana ka ya mon test so be ar dum kula te man and ite test ite negative o la but bi na tabu kuma exposed because sa pileno ko malati so ta mal to raje yewlo neba e apoto to ite ni min be kur fanyo ari nyoka ali mu neke ini juballe be nyokono mbe alone airport o doli yale control airport o jang hadi natal kan sika judal kan fenke nyoka Belgium je nde tata ngal terinda
defo so kan yula le docteur manja defo
yale defo katamal e ñu jilal wol ka jurmi nyoka jame fa wala fon garawtan to lajja so bi kaw to fode ita je fola fale andra fana jabe tawndin alon ne min be keri bari alinga nyum ko muta jofe bang nga muta jofe kuku ye biro sto ga landi bari sa fale police almasol use ku ila maso daro e daba ene mo kana sia isa dunku ay lum cover kane lum to bante butu e bendi jile ka tale malo yajele akadun la droplet lam virus la akadun nuna ko nyokono so isa kata akana ya be cover ni be jama kono ni be suwo ko be friri dama ya bondi nudo ma fo fana ko butite ka basko dundro hani be la bunko be nudo dro ma fo fana ni be bunko re dama ni modi je be friri da ko ya lan ni mu ya de bo dunde ka ba me kala lo ma so sikya this is it mi be official to mbaldan ala official de kale ske da na fa ar buto hani be official to do dia to so do nyam par ni bi de mo dunde ka ba so dum ale physical distancing ke wala le da fa no yela bolke kay tol mi ke bu ke sa bana ite malo fu janna be na mari ar bu fele ba fa bu ke amma han sanitizer de bunde kay to jimmu de asay ne han sanitizer de ku de ya be sanitize ya jele kada nyine fanna ya jele so be hakilo nyimu hakilo to to atata na de hakilo to fanto ha hatu chole ya lotul fanto dro
barka baake docteur Manjang say wato min destaman sia docteur Diagne lu ñu dese si time bariwul benn 10 minutes rek la xam naa yéen a ngi busy yéen moom kenn waru leen a téye si programme yi yu longer time but waxtaan bi dafa am solo trop moo taxi tey ma bëgg a jël advantage rek pour waxtaan ak yéen because yaakaar naa ne Gambien yu bari nañ jàng man suma boppa jàng naa lu bari si ñoo yéen because most of us su ma ñëwee is more about being a little confrontational di lay wane no defu leen lii but at some point soo waxtaanee do you see the realities yi nga xam ne dëgga li ñuy jànkuwanteel tey time bi nekkagut pour some of those things it's about time we put our hands together and work towards lii waaye bala maa ñëw si health workers yi seen aspect dama bugga tey man ma toog suma kër ma am some issues ma feel ne maa ngi am symptoms amanguma access to testing or even because tey xam naa ne space yu bari amut pour ngeen mun a quarantine te na ngeen encourage ñu mun a quarantine seen boppa ñu def ko si kër yi ñu isolate seen boppa tey ku feel ne daal yaram joints yaa ngi métti démba toog naa rek su ma yax yi di métti ma ne woy corona naa lan lay jël xam nga fa fu mu ne nii dëkk bi dafa métti ragal nañoo dem si lopitaan yi because you never know if man I always tell people dafa óorut tax dem si lopitaan yi noonu te xamuloo sa status because mun ngaa dem infect doctors yooyu noonu te tey we need doctors to be more si lopitaan yi léegi ku mel ni man tey bu ma demee suspect ne xëj na maa ngi am some signs wara maa ngi xaw a ragal lan laa mun a jël tey rek suma kër basic stuff yoo xam ne mun naa dimbale suma immune system bi wara mun a dimbale si suma boppam lan laa mun a def basic stuff yoo xam ne every Gambian war na ko mun a def këram.
So first of all, lekkal lu war a lekk. Make sure you are fed well.
Okay.
You're fed well. I'll start with that. Just make sure that they are fed well. You eat a lot of vegetables and the fruits. Because one of the things that people seem to tell when you boost immunity is vitamin C. And there's multivitamins that people are fancy about zinc. It's just to improve your immunity. Because they are building blocks for your immunity. But bala may wax nit ñi ne dama jël vitamin C naanal sa sorans jëlal sa mango nga lekk ko jëlal sa papakaya bi boo ji sa boppa nga jël ko nga lekk ko and try to eat well. And then as you are at home, do your exercise. Okay? Walking around the house. You don't need to run out of the house to go and do exercise. You can do that at home. Mun nga doxantu si biir kër gi, okay? Su ne mag nga si état bi mun nga doxantu si biir état bi, loolu is an option. Ñoo xam ne they have other means to exercise, just to do that. And that's all to improve your strength. Then so they am symptoms of like I'm sure you've heard of honey, you've heard of lemon, lime juice and stuff. They all are very good vitamin supplements. So you mun nga jël. Okay, sometimes comme nu ma dee waxee rek xam nga soo jógee Falkunda nga ne ko demal jël lem rek. Moom dafa jël butel rek ne ko di ko tuur rek di ko ñoom diñ ko dee caaxaane, but it's not like that. So ne am nga hot water nga am sa lime and then you put it in it and just like tea you nga naan ko once or twice a day. That's all important. I mean, just to improve your nga yokk si sa lekk yi nga dee lekk, just to boost your immunity. So ne am nga lekk you am comme ganaar la or yappa or whatever it is, but the point is vegetables are quite important and Gambians loolu fankawuñ ko noonu. And then fruit, they are very important. Yooyu am na solo trop. So demee ba nga gis ne sa yaram understand lo sooba or sa yaram muy tànga ñu ne ku nekk soriwante leen and then you stay away from each other. But at that point you need to keep more away from people. If ne yaa ngi amee njaboot, just keep them at a distance away from you. Depending on what symptoms you have. So ne yaram moo tànga, paracetamol is okay. You can take paracetamol. su ne da nga soj piritin cetirizine loratadine ñooñu the antihistamines ñoo xam ne mu ngeen naa jël soo amee demee ba nga gis na yaa ngi amee comme runny nose you can be able to use that. And tea and lime, it's good. You can take lime and tea, lime and honey with tea. Just to make sure that the symptoms get better. And then some ginger, you can take ginger with lime or ginger with tea. All those are options that you can do to improve the symptoms. So you need to confine yourself to a place where you're not going to get in contact with people, and then call. Okay, call 1025, call whoever you can talk to, and let them know, announce that you are here and this is what you are having. And then the next thing is for us to find a way to get to where you are, or find a place where we can meet up with you. Okay, some people will go in Kiri, okay, because they don't want to be sad to be do something more in the So we're happy with that. We respect people's privacy, and we will want you okay, and then you to say you sample sooner you think that for the car is not safe enough for you to be there. Manjang and others will handle you very well. Then you before stay. Sooner your symptoms are so serious and you can be at home, then you for support. We're also waiting for the result. I'm sure we'll start all the treatment that you need to do, because result is just to tell you whether you or not you have it. But symptoms and signs more than I'm solo. So we'll soon come in, we'll start treating you as quickly as possible. So that is the point. So how many issues you feel is not okay, go look for a place woman at all, and then arrange your body as a harity. Unfortunately, at the beginning, this wasn't happening. Then I just go the fever, then come out the nyaposi cow ninyi the joy and tusi ninyi, and people are hugging him, they were by test the result positive. And that is where the problem is. You know, funya break and news you cannot find it. Okay, and you instead of ninyi, you tend to get more people in it. You know, and some people don't even say dinko noba, and then you find them. You know, somebody's calling from office, some office this morning, whatever. Can I be in you could just test the source and tell me office? Link you know, yes, I'm not result. I'm on Harris so he has to go to the office, but I'm with them. You call them, you go to treatment center. So the office. So that's not a good approach. The approach is that so they are suspects about, and you think that you may have the disease, isolate us about. Neck out for hamne. You can talk to people and keep a distance from them, especially on your body. You know, that's different. But so they may ham right. The better you keep away from people, the more you keep away from people, the better. Then you all okay, but you need to talk all more. So talk and follow and talk on, and or test result with you. Because with you will take it up from there. We'll pick you to wherever we take you to. Sometimes it may be not even necessary. Because sometimes I just call I'm not symptoms like 2 weeks ago, only for the test results to come after that. So now all you need is just to wait for him to go into the convalescent period, and then the two spread na ko. So the manner more gonna solo. If you don't trust yourself, stay away from people. And then keep away from them just to protect them. And you can easily put this up. Don't disturb, I don't have time on their WhatsApp status or something. You can just equally do that. I mean, to say that young fee and kai, you know that your office is a very public place and people are going to visit you often. Understand lots of okay, call in sick and then stay at home and let everybody in the household know that you're not feeling well and you think you need to be on your own. At least you can be on your own, and then definitely it will get better with time. I mean, the results is there. If his test is negative, then you go on your business and you can solve other issues that you think could explain the illness. But before that, is that you are earning.
Thank you very much, Dr. Janya. Dr. Buba, Dr. Janya min foten akumayata bake. Ni mol sasata dol ba fula ali vitamin C ta al vitamin dolta bari momi yalon ko mala dépense fon keno wobe vitamin C tablet sol sanno la nyaade bari fengol mimbe ko le munol ning soran sol ning bananol ning fruit sol anin vegetable sol mi yalon ko fengol lo ke do ku so ko akumayata pour que nyim fo baadi ngole ya long fengol min se mako eno bari kudo fana lafta ni boto to o ma wala the stigmatization ninti bayri nte fango personally nga experience to je ila fumigation team I requested pour ye na office of fumigate and then I said okay maybe the mandindes that we can go to my house but at that point in the car kabri meji kan because of moto ni na look rek nka lanko alla mole ko ni moto na lo tanadato mol ba mira la case le bijam. And okay, I said that is good. Maybe the abatina les sungolus it woltina na swokono. But guess what? After they left my house, Molielo Ndisilokan, and Lamin was they were so surprised how people were checking and asking them, Hana Kirby the farm case, Hana Kirby the farm. So mentally for me, I know that this is what I wanted. I wanted people to be scared to come to my house. It was good. But what about Modul Mini Alonko? Ibesila la wolal. Hani be a case to telefila moya long, iba mabolale. Ibela fila because mole nyin sasa muta nyami. Aku mayata mole alo. Ko vice president we fawon sasa to da min telo njumati fo mesila ka fo ko ngani sasa soto baba queen dingo e sasa soto Angleterre le prime minister ya soto Gambia America ni actors bali ya soto finti tanang iko ngani sasa soto akumata badi ngol ya lon ko nyin sasa ma mojube amam foire jube amam koditi jube amam mojube andum kana mol treat ko nyin sasa be la rek nyanta borele la wo kumata bake anim fana mol nyanta I mean supplements that are mi ko locally available ta wato minute lulda mal desta pour ngol jube.
Okay, abata ba Fatu wo ko ba ba kele jaja be man ne wala somo de media lo be fon fi school kono ise wolta yirde wol be ning fon kol ke ta ke fanda pala ka do mo beto ke because thing is all about immunity barola immunity bang is sembo soto pour le kulo de du jero don ate écouter na wanyama tata wala ane exercise is exercise ke you know if I stress free fana hada ma do stress fana kan boss da akela call samba dumale ye fan free ye fan da hande but ni data stigmatization wala fandala bimbo ko nyin covid-19 na fandala dol kaje nyame kaje ko ni data kende amol na tan so ko ndiye je drone ino ba mira ko onjim bi janden mulbe borla o korraje na wallete mari mol se jam fela nte amira selde nyalta trala ka joma ko nkana nyoki jo farandi nkana nyo borindi bari mikku bara ko kono tolewol korosi kol kono wala atinda dolbi je mini alonko nke mabel mini alonko ite malla fi moya bo kalama ko jang nyimpura nyi abijande wala imalla fi kanna molje yesu tiela korrala puru hakelante ite signolu kana je ko kule bijang nika kacha ida ifo yene faye ye fam bori di bara bitali di be okle di fam be faye be fan sambara nan ni tankandiro bundan ka fele be benekela no masoduna ye fan drive ye na ye futa quarantine center ye dum peacefully ye quarantine moma boy kala yaje walla mudo bina foti kira karate futale ya ifo yene ye dum yeta yaje wo ferul be ka kele comme c'est ya yete walla fi boja wala futela soko pour hakilo nataje ko tumando bo sikete okay dol fanan ko dol fanan ko mira sifal sotole barin ka fahamu fele bari dol fanan ye molle soto media lonko e ka foi psychosocial officers within the Ministry of Health aning risk communication fanan be mol bijene so nyini kam bol kono to dial nyini ni ka kachale e ka kibaro boy nyoto psychosocial wol kanale kaje ko ye diamu ye puri sondo mo kana wisi wasa soto puri sondo mo kana kole aku soto hadin na quarantine center ngol soto jeel e ka diamu ye because ne mo taya quarantine to kapare aka frustration wala soto so data je wo frustration o ka o pro fa wala moti bi alok sa mom mu psychosocial bolti se diamu ye puri ke sondo mo tenkundi andu nat nyanta jela ko jimu virus drone kurawle ku comme ça courant ko tawol be jame comme ça ala janjaw kamma jaba kono ande ala matoro la kariya wala tinda ate control na atata ni fandala. But kurang lebih alo kurang kerol benane. And one good thing about this virus is na muda asekendano. Na lu fenden dia muda sila daki. Itu baru dapat. Barkin na ko ito abi ma hade na C3 pol ni kari. Isa je sa ko ni mo na gam le kenda tapi yol bula. Kodi so iba ila ko ani mo na gam le sud. Dol dara. Ba sere da bara kenda na flase na. Mo ko te mo ko te. So na muda ni ka kenda ni. Isa kenda do le eta. No aka wajja bi mini la fana wol fana tubando de topoto rosoto ese ala se tankandi ye kana so wala tinan kafo nga nyoma ko akawaje min lan kane mantora ite baladna kana ta yemo mi yalo ka be soko na akawaje bal so wol asol bantora bo kura de mi self limited akanal for certain stage ay bo ay da handu yajel ye da ila bala so jarol ya be kila be bo balo ko ye kende a kere ye murula do ko le te la ko la alkana sila ba ke bole falale nse sila bar silo jin kana danna tambi fayan dum kudola fayan dum na moli mfola moli ka borila wole dum stress soto ha ngal soto mo tankandi drong ngal la moy jata kendala tankandi ko la ngol tamandi drong tumando be ka fu nyola tumando inshallah fatu tumando ala sinande ma ani ala dano
barka bake Dr. Buo so ilafta mune ya mardi la nyanta bi jata kende ado kulal minal ko tolle ben loptano to bi nyante support la nyaadi le finally in just 1 minute health workers all nyanta mun support le dila bayri I mean kala nyindi amu nya fa la moy dorong is emotional for some of us sakatuma atol mi yalon ko atol le ka ñunu deal every day al doctorol ñi small mi yalon ko be ke ni ba atol le bulu every single day you go through this. Be Gambian or Mimbe Jibiro, you support the healthcare workers, especially at this time.
Gambero nyata support min dila mola wala. Daftan kaki barkendo boy. Yani, bao ite niyo sankayale. Kaje ko number 1, yela suwo bulaje, ibe kataje. Number 2, yaje ko nyukura ite ne eka minute dol ka minute ko to wal bu bollete min yalo dol ya soto dol maso. Yaje so sa ite fon exposed tal. If I was soto no anytime. So nite bo wo katako ke ka buru mini be suwo ko do se tanka. Nka lafile alla kibarol kala fo ya do mandi. Bandi bo katako le de bo bada kono. Yena boy hanu e ka kudo fo biyalo ko kudi mindi ba atra wonten to nyati fang aka discouragement sam so nga katan na hel wo kasol nge encourage nge support am support banke ko kodoti de kodo da mante de support molde indi mbara damo aka bo sawarlen al dimbara al bakang hel wo kasol he tenin takala fo kibar si falle moyla hel wo kasol fanna gambia fanna be ba katakan security fanna be da security fanna be ba katakan yajene mo kotol min be yin celo kono fitar lal driveol min ka mol samba mo kotol be ibe do kane ba katakan you see so ngara min kumata wala ngeke encourage dom hanima ko li bola barkara ko tilim balo fo do ko fo la marima ye di brande ke feke be fallo bra ko do makara yaye so say ite mo bla bol ma tawante to yadi ite min jubbi babe sela ngana to do principal na ku ke do so no am na jate ke na mo adinge encourage bam adinge to pro bam wala tin la protection is a major priority kadi ko jate ke dalbe a nosi lewo a doctor lewo a publican lewo a soldier lewo all the front liners alinga katani encourage kuma kendol ka foema ali nimbara saje boy sawar alingo kata banga fata ñu kume sen de wala to te wala so nga fo flagam non please.
Thank you very much, Dr. Buba. Kontanta bake akacha diata akakolele ka also to badni also to wala nan kala fini kacha sifala ngal tento ngal jayi Dr. Jan bala ñoo dem nak xamna ne nak man mom emotionally I've said it man lopitan sax duma fa dem much more to deal with all of these things. I know these are very trying times for all of the health workers. Ñu ngi gis ne health workers yu bari ñu ngi infected but bés bu ñu wéré ci elexi li leen njëkka itel mooy ñu daw si lopitaan yi dem di dimbale ñun patients yi gis nañ ne am na some of you guys depuis March yéen a ngi bàyyi seen njaboot nekk ci l'hôpital hôtel yi nekk ci treatment centers yi di daw guddi bëccëg di toppatoo. I know ne we have not said thank you enough to some of you guys because xëj na am na ñoo xam ne xamuñ liggéey bi ngeen a def waaye ñi some of us xam nañ health workers yi with the little resources what you guys are doing ñun xam nañ ko waaye ñu bari tam xam nañ ko moo tax tey pour suma viewers yi ñi nga xam ne ñu ngi seetaan lan nga foog ne tey at this trying times wax naa ko keroog si programme yi ma ne man bokk naa ci ñi nga xam ne dama dee bugg a keep people accountable sakatuma public officials yi buñ ñoo liggéeyal war nañoo xool liñ leen jox naka lañ ko séentoo waaye nag wax naa tam ne at this point dañ nekk si pandemic te buñ nekkee si pandemic all hands should be on deck pour ñu liggéey pour make sure ne ñu xeex jàngoro bi buñ paree ñu xool lan moo nekkoon right lan moo wrong waaye tey buñ ñëwee di wax ne docteurs yi nekk si treatment center bi lii lañ def ñii lii lañ def dafa métti dafa nasaxal liggéey bi lan nga foog ne lan lañ mun a jàppale docteurs yi ñi nga xam ne ñu ngi ci lopitaan yi ñi nga xam ne ñu ngi in contact with patients every single day ñoom seen boppa ñu ngi feebar yóbbu feebar yi seen joboot ji lan lañ leen mun a encourager tey pour ndax ñu mun a liggéey seen liggéey bi te su boobaa liggéey bi duñ ko mën a naxasal.
Fatou, thank you very much. I'm just I always say, man, I'm just a vehicle, or I'm just an agent to coordinate what's going on. I hardly, I'm a clinician, man, more patient, and I go in and do it. But I'm more impressed by the young people that I see in Gambia, and they give me a lot of encouragement. A lot of youth in this country that have sacrificed, that are bold enough to take up this initiative. And some of them are even here. The parents don't want them to be here.
Mm-hmm.
You know, they've torn down their parents' fear into their strength, and they're here. They're sacrificing for their country. I think those are the people we should be praising. I mean, we should be Gambians should look and thank these people, because some of them they come from morning to evening. They don't eat. Some are 24 hours they are working. You solve those very hard. Come nilon bag nga sol, ñu dugal la si bag ñu takala, and then you go into that place 3-4 hours yang si biir, so you nga ñaar toy fekka, you know, sweat is all into your eyes, and you know, thinking about whether anyone nga February bala nga génn wala ñu ngay génn ñu raxas la with or rasawel be after they génn la nga dem solale. Those are huge tasks. They're very, very difficult moments. These are youngsters. Some of them, they are not married. Some have no kids. If they have the disease, they can die from it. But if you all that, they have a lot of courage. I thank them a lot. And I just always thank them for the trust they have in me and letting me lead them into this crisis. I'm so humble with it. I always, I always say, they are the ones that should be thanking, because people don't even see what they do.
Yeah.
At the middle of the darkness, at the good moments of night, they are no longer Ellen, please juggle, Kili Dimokojat, Kai Kalanjerico, drivers, the securities at the gate, the police, the oddlies. Probably used to clean in a ward. They clean on a ward, and there are COVID patients around them. And then you are young for the fumba, suba, gone. Those are huge moments. These are people who are sacrificing their lives. They are sacrificing their comfort. They are leaving their families. They are risking their families, risking their lives for the country. They need a lot of thank you. I appreciate that a lot, and I want to use every opportunity that I can have to thank them for the good job they're doing. Some of them, only God knows. Gambians cannot pay them. Gambians cannot say thank you enough to them. I'm very grateful to them, and I sincerely want to say this at any moment, and I will advise every Gambian, they are working for the good of this country. There's no money that will be able to pay these people. There's no amount of thank you that will be enough for even one day in that treatment center. So I want to thank them. I appreciate everything they do. I appreciate all the obedience and the patience they have. I appreciate all the time they have to make us go through this. at very difficult moments, under very difficult circumstances. I thank them very much.
Thank you very much, Dr. Jain. Thank you, Dr. Abuba. Through you, we want to use this opportunity to thank the entire health workers, the frontliners, for the sacrifice you do every single day to keep us all healthy. I know these are difficult times, and sometimes we will criticize you because we might think you're not doing enough, but that doesn't mean we are not appreciative of what you are doing. And we want to thank you for your service to the nation. I hope so many Gambians can say this, but a lot of us are appreciative of what you're doing, especially with the legal resources that are available in our country. We want to thank you. Thank you very much, Dr. Jan, through you, your entire team, and to you, Dr. Boba, through you, to your entire team. And of course, Lamin and his crew, they came to fumigate my office and my house. I want to thank them very much. Thank you very much. We do appreciate everything that you guys are doing. I hope we can have this conversation again sometimes if you guys are free. Pour ñu mun na empower our people. And I know ne man learn na a lot, and I'm sure so many other Gambians are learning a lot about the realities. Learn more than and we're gonna keep you in in our prayers. We know you guys are every day you are at risk of contracting the disease, and but you're still working hard to keep us safe. Thank you very much, guys. I do appreciate this conversation. Thank you very much, Dr. Jan and Dr. Boba.
Thank you.
Thank you. Thank you very much, Fatou. Thank you.
Thank you.
Thank you so
And
much.
to you guys watching, thank you very much. We will be back tomorrow with another guest
Yeah.
until we come your way. Bye-bye. See you soon.
Bye-bye.
Bye. Thank you very much.
Okay.
Thank you.
Bye-bye.
Bye.